Think seizures are always dramatic shaking? Think again. Let's bust some myth about seizure. Growing up, I used to think that when someone has a seizure, you don't get close to them. First myth, seizures are not contagious. You cannot have seizure because you help someone who is experiencing seizure. Another myth I believed while growing up is that when someone is having a seizure experience, you put some hard object in their mouth, maybe a steel spoon, just to prevent them from hurting their teeth. Stop doing that if you ever believe that. That's very dangerous. They can choke. They can bite on that thing. They can injure you because it's an involuntary response. Welcome to another time of Health and Wellness with Olajumoke. Today, I'll be sharing some about seizure today. What really is seizure? In simple terms, seizure is just an abnormal electrical activity going on in the brain. If it is just one occurrence, we call it seizure. If it's happened more than once, then we call it epilepsy, meaning it has happened more than one times. That's where there is a diagnosis for epilepsy. And seizure doesn't just mean people will be shaking uncontrollably. What are the common signs and symptoms of seizure? It could be confusion, dizziness. Sometimes they could only just be staring into the atmosphere. People are just still, you're talking to them, but they are out of where you're talking. They are not there again because they're having an abnormal activity in their brain. Their brain couldn't pick whatsoever you're doing. Jerking, shaking, loss of consciousness or awareness. It is not every seizure that requires hospitalization, especially if it is not a first-time seizure. So if you are seeing someone experiencing a seizure, what should you do as a good neighbor? One, be calm. Two, clear the environment of anything that may be harmful. If they are sitting down, you may want to position them to the floor. If they are standing up, you may want to position them to the floor so that they don't fall and injure any other part of their body. So you want to keep them safe. Make sure everything around the environment is cleared. Thirdly, you want to roll them to the side. You want them to be lying on their side, either on the left or the right side. It really doesn't matter. But you don't want them to be laying on their chest or on their back. Why? Because the saliva coming out of their mouth can return back if it is not to the side. When you put them to the side, the saliva can drain out. Whatever is coming out from them can drain out to the floor. If they are on their back, it may go back to their mouth and then down their throat, and they may aspirate on their own saliva. You don't want them to do that. So you want to roll them to the side so whatever is coming out will just drain out. And another thing you can do as an onlooker is to time it. Check what time did it start, so that when it finishes, you can give a report to whoever is an healthcare professional or even the one that experienced it. If there is no healthcare professional around you, you can just say, okay, I think it happened for so time. This can help the healthcare professionals to know how to program their medication, to know what else to do in case of such emergency. If you're an onlooker or a bystander around someone having seizure, when should you call for help? Once a seizure lasts for more than 3 to 4 minutes, you should call for help. Especially if you don't know anything about seizure, its management, you call your 911 immediately you see someone experiencing seizure. Call 911 immediately you see someone experiencing seizure. Or if you have someone who is very trained, you can watch and do everything we have talked about today. And once it lasts for more than 3-4 minutes, you want to invite help. While seizure is not preventable, there are some things you can do to reduce the frequency. One, sleep. You need to be having sufficient amount of sleep. Lack of sleep is a common trigger. Number two, manage stress. You can manage stress with activity like mindfulness, breathing, and regular exercise. Number three, take your medication as prescribed. Avoid skipping your dose for any reason. Lastly, consistent meal and hydration. For those living with seizure disorder, having a personalized care with your healthcare provider is very key. Medication management, lifestyle adjustments, and regular checkups can make a lot of difference. Seizure don't define a person. With the right knowledge, we can all be better prepared for ourselves or to help others in the future. Thanks for watching. If you'd like to hear some more information about topics like this, please like, share, and subscribe. See you soon. Bye for now.